Hello everyone. So today we are going to discuss about the anatomy and physiology of the cranial nerve 4. So what is actually the cranial nerve 4? This is the other name of the cranial nerve 4 is the trochlear nerve, and this word is derived from the Latin word which means the trochlea. And over here one more important thing is that why is it named as why is it derived from the name trochlea? So it is because the muscle it supplies to, or the muscle which is innervated by the cranial nerve 4, passes from a pulley like structure, right? So it passes from a pulley, that is trochlea. That is why this nerve is named as a trochlear nerve, and this is the longest. That means 75 millimeter. Its length is 75 millimeter. This is the longest cranial nerve and is the thinnest as well. It has less fibers, nerve fibers, which are approximately about 3400 fibers, and it supplies to the superior oblique muscle of the eye. So I have told you that the muscle it innervates passes through a pulley. So which muscle it innervates is the superior oblique, and this nerve, is the totally in motor in function. What does motor in function means? That this nerve sends the motor command from brain to the structure it innervates, or I have already told you that it's innervation, or it provides innervation to the superior oblique. So this in nerve sends the innervation to the superior oblique for the movement, right? So motor means that the nerve is sending the efferent signals or fibers, or it is sending the command to the uh, muscle to perform the action, right? So that is why it is totally motor in function, and it originates from the small nucleus in the midbrain. So we will discuss further that the cranial nerve 3, which is the oculomotor nerve, also originates in the midbrain. So the difference between that cranial nerve nucleus 3 nucleus, oculomotor nerve nucleus, and the cranial nerve 4 trochlear nerve nucleus is that the nuclei of third nerve is larger as compared to the nuclei of the fourth nerve, right? So they both are originated in the midbrain, but the levels are different, right? So we will discuss in later videos that what is the origination point of the oculomotor nerve or cranial nerve 3, but right now we are focusing on the cranial nerve 4. So this nerve originates in the small nucleus, and it is bit small in the midbrain, and specifically at the level of the inferior colliculi. We will discuss it further in the next videos, right? But right now it is just an introduction. And what is cranial nerve, what are the structures of what is importance of the cranial nerve, it's just an introduction. And what is the physiology, and the physiology would be the function of this nerve. So let's move on. Now this nerve is very unique nerve because it has three important points, or it has some three important characteristics, right, which no other nerve has. So the trochlear nerve is unique in three aspects because it is the only nerve that emerges from the posterior surface of the brain stem, right? So what is a brain stem? It is a structure which is made up of three further structures of the brain. One is midbrain, second is bone, and third is the medulla oblongata. So these three structures when combined are named as the brain stem. So this nerve, trochlear nerve fourth, is the only nerve that emerges from the back surface of the back dorsal region, or the posterior surface of the brain stem, and the nerve fiber decussate or cross over to the other side of the brain stem. So this means that when the nerve emerges from the nucleus, it moves to the opposite sides, right? Or the nerve fibers are crossed. So that means that the nerve fiber from the right nucleus move to the left side, and the nerve fiber from the left nucleus move to the right side. So that is how the nerve fiber cross over. So this means that nerve originating in the nucleus contralateral to the muscle it supplies. So what does it means? That the nerve originating in the nucleus, this contralateral means that nucleus is present in the opposite side, and the muscle to which it supplies is on the other side. So if we are talking about right eye superior oblique, so its nucleus will be in the if we are talking about right eye superior oblique nerve, trochlear nerve, that trochlear nerve is applying to the right eye superior oblique, so its nucleus will be onto the left side. And if we are talking about left side superior oblique nerve, so superior obliques innervated nerve, that is trochlear nerve, or left eye's trochlear nerve. So that means that its nucleus is located onto the right side of the brainstem. So over here you can see in this picture that this is the nucleus. These are the nucleus of the trochlear nerve 4, and the fiber from the right side move. First step is that the first unique aspect we have discussed is that the nerve fibers originate from the posterior side. So this is the ventral or anterior side of the brainstem, and this is the posterior or dorsal or the back surface of the brainstem. So this is the only nerve, and that is why it is the longest nerve, because it is having a long route. It is moving from the back side of the brainstem and coming to the eye, or moving towards the forward in the forward direction. So that is why it is the longest nerve. And you can see over here they are crossing over. The nucleus of the right eye is here, but the nerve is moving towards the left side, and here the nucleus of the left eye is the nerve emerging from it is moving to the right side and will supply to the right superior oblique muscle. So this is how the crossing over occurs. And if we are discussing about the palsy, so this means that if the palsy of superior oblique is present in the right eye, and the problem is in the nuclei level, right? So this means that the palsy is in the right eye superior oblique will be linked to the left side of the brain nucleus, because we have said the nucleus is present in the contralateral side. So this was all about the introduction of the anatomy of the cranial nerve. For now, we are going to discuss the course of the trochlear nerve in the next video, and then the function of the trochlear nerve or the muscle it innervates to in detail in the next further videos. For now, it was all about today's lecture. If you have any problem during the concept of trochlear nerve, you can comment in comment section. Thank you so much.